A lot of how we practice medicine has changed since COVID-19. One thing's for sure, we probably ordered more chest x-rays than usual, and maybe we're still stuck in this pattern. In the COVID era, in order to keep patients in isolation and prevent the spread of disease, chest x-rays were mainly done portable. This meant not only were we sacrificing the PA view for the inferior AP radiograph, but also we were no longer getting that lateral chest x-ray. In the next episode of the RAD Review, we're going to do some lateral thinking on chest x-rays, reviewing the benefit to obtaining the orthogonal view to the frontal radiograph, the soon may be forgotten lateral view on the chest x-ray. So let's start with this case of a man with a fever and a cough. Go ahead and hit pause to see if you find any abnormalities. Would you call this a negative chest x-ray? Yeah, probably, until you look at the lateral view and you see some schmutz projecting over the lower thoracic spine, suggesting in fact that this patient has a left lower lobe pneumonia. This, folks, is called the spine sign. Normally, the spine is going to appear darker or more black as you trace it from top to bottom, approaching the diaphragm on a lateral chest x-ray. This is because the x-ray beam in the upper spine is attenuated by more bones and muscles of the shoulder girdle. If there is a pneumonia or mass or fluid that is present in the lower lung, it will project over the spine, and the spine will appear more white and less dark. This highlights one of the many reasons to obtain the lateral x-ray. Here is another more obvious example of the spine sign, where instead of the spine appearing darker as you move down, it becomes more white due to an overlying left lower lobe consolidation. Now, the lateral x-ray is essentially great because it allows us to pick up on more pathology. As with all things, it's important to pay attention to the negative space. There are 3 darkenings to look for. The first we talked about already. The spine becomes more dark or more lucent towards the diaphragm. The next is the area between the sternum and the anterior heart called the retrosternal space, which should appear relatively dark. And lastly, the area which is just posterior to the heart and anterior to the spine called the retrocardiac space, which should also appear dark. So here is an example of a retrosternal space opacity due to an anterior mediastinal mass, which is less evident on the frontal chest x-ray. Here is an example of an x-ray that is relatively normal in appearance on the frontal view. However, when you look at the lateral chest x-ray, there's evidence of a retrocardiac opacity, which turned out to be a malignant mass. Lastly, lateral films can help us identify pleural effusions, which might be missed on the frontal view. Lateral films are able to identify a smaller amount of fluid as the costophrenic angle is deepest posteriorly. As always, we're going to wrap up with some RAD review pearls. Remember that the spine sign is where the thoracic spine appears more white or radiopaque towards the diaphragm due to an overlying pneumonia or mass or fluid in the lower lungs. Remember, normally this area, the spine should appear darker. Pearl number 2, remember to look for the 3 darkenings, the retrosternal space, the retrocardiac space, and remember that spine should appear darker towards the diaphragm. Before I let you go, I want to tell you a quick trick that you can use on your next shift. How many of you have struggled with identifying the left versus the right hemidiaphragm on a lateral chest x-ray? I know I have until I learned this quick trick. Remember that the left hemidiaphragm is going to, so to speak, run into the heart, so it will become less distinct at the lower edge of the heart compared to the right hemidiaphragm, which is going to extend fully from the posterior to the anterior chest wall. Thank you all for tuning into this episode of the RAD Review. Don't let that lateral chest x-ray become a relic of the pre-COVID era.